Okay, well, I was just saying to our next guest, Dr. Michael Hughes, who invented, I would say, he's the entrepreneur and invention of secondopinions.com. It's for your peace of mind. And since I met you, it's kind of like when you buy a red car, all of a sudden you see all the red cars, which you notice. Now all I see are second opinions. You better get a second opinion. I mean, anything that would happen to me, get a second opinion. No matter what it is, if your children are not doing well in school or something, get a second opinion and see what the tutor's doing, right?
It's a pretty viral concept, correct? Especially in medicine.
It is viral.
It's important.
But you're young, but 50 years ago.
Not that young.
Yeah,
I turned 40 last month.
You're still young. But in 50 years ago in medicine, Michael, second opinions was kind of a dirty word, just because those older doctors, they were God. They didn't, whatever they said, that's it.
Nobody wanted to be questioned. And this is one of the reasons for what all the issues that we have in medicine today is because doctors are practicing without balance and checks. And this is the reason why one of the mechanisms by which we can control uncontrolled spending, unnecessary procedures, and also catch medical errors. So this is one of the mechanisms which we're lacking in medicine.
Yeah, I really appreciate that you say that, being a physician, because you're a physician first. You were trained as a radiologist, and you must have seen a lot of this. You must have seen errors, and so look, everyone's human. Even though they're a well-trained physician, maybe they're tired, something happens, they look at something the wrong way. But it could be, life. I don't know what the word is. I want to say
a matter of life and death.
Yeah,
sometimes.
Thank you. I lost the word, matter of life or death. So having a second opinion, and I would think that doctors would even like that, because then they know that they're not doing something wrong for their patient. I mean, especially what you're doing, and I want to bring that up. You aren't just doing a second opinion with another doctor down the street.
We have some of the best physicians. When it comes to your health, second opinion can be, like you said, a matter of life and death. So it's a good idea to invest into your second opinion and making sure you're on the right track.
Well, let's just move that further. Now, you're seeing that the second opinion that you invented here in the United States, is you're really taking this worldwide.
Correct. We have already customers and patients across the globe. Over 60 countries. Patients in over 60 countries have used our service so far. And we've only been around for 12 months.
I mean, it seems like that's right, because that's true. I remember first meeting you, and this was a very new concept, and you were very excited about it. What do you attribute to your moving so fast and getting this so well known?
Well, like anything, the timing is important. So, obviously, the combination of political trends with Obamacare and the global trends, where now it's one flat world, and everybody loves and respects and realizes American physicians are best trained and possess the most knowledge, most research on the planet, and so we took some of the best physicians, not just in the planet, but actually in the United States, some of the best physicians within the United States, and bring them on the plate to everybody at their fingertips. And so it's a good timing, and it's an important mission that we have to help people that causes such a great exposure and growth.
Yeah, it's interesting how you put that. Something else you told me the last time you were on the show is that you were now even going to let people consult about other things, medical, but that it wasn't just analyzing. At first it was getting the film and analyzing that film and saying, okay, what's wrong. But now so if someone has cancer and they don't know what to do, you said you now will bring on a group of specialists to help them. Why don't you discuss that?
We have when we started, it was only imaging, but we have over 1,000 physicians in every specialty and subspecialty right now that can consult for any range of disease or any from a simple disease to a complex congenital disorder, for example. So right now we have a panel of doctors that can consult on a complex condition. For example, if somebody has a complicated course or, for example, breast cancer with multiple doctors that need to be involved, we can bring a panel of doctors, for example, radiation oncologist, surgeon, radiologist, and who can consult and create a multi-specialty consultation with case management. So we see more and more of those, the need for this type of consultations.
I totally agree with you, because it's always like, oh my goodness, what do I do now? You have a woman who, I just had a mastectomy and everything, thank goodness, was fine and all. But I can picture if all of a sudden something was, of course, I'd run to you immediately and I'd have you recheck it.
You better.
I would have. No,
I promise.
I'm of course. Oh, you've got me, honey. No problem with that. Right. But then let's say something happens. Then you have to say, well, the doctor says this, or this one says that, or a friend says this. You don't know what to do.
Exactly. And sometimes we have a complicated condition, like a congenital disorder, that involves multiple organs, and sometimes you need a panel of doctors, not just one doctor. So we can now offer this.
Yeah, and I think that you certainly, of course, you had the experience of your son and what had happened with him, and it's only through, it was a fluke that you actually went and found someone who's asked you certain kinds of questions. And, how did all this happen?
Right. This is how the idea was born for the service. But right, exactly.
So when you also think about people now, there are a lot of men who have prostate cancer, and there's someone that says, well, you should do it, you don't have to do it, you can leave it alone, you can have radical prostatectomy. And so there's a lot of questions, something, that we don't usually think about. But because we used to just say whatever our doctor said, the oncologist says this, but I think they definitely should call you and at least get a second opinion of the panel.
Exactly. If it's a complicated condition, then it could be few specialists that could advise.
Because we have people with lung cancer, we have people with brain cancer. I mean, there's lots of it out there, and some people they just drive up or they fly up to Sloan Kettering or one of the big fancy hospitals. But using your services could probably make it even easier, because some of those people might suggest that they go to a place where they know they are doing certain kind of clinical trials and have special drugs, right?
Correct. So after we do this type of consultation, multi-specialty consultation, there's a case manager, usually a physician, who then evaluates the whole case and sends the patient to the best possible hospital if needed, or recommends best possible treatment for this type of condition. I
am very, very impressed with what you have been able to do, of course, starting out with your company. SecondOpinions.com. Anybody wants to just get online, they can see it. Beautiful website, and you'll see all that he's doing. Tell me about what you think is going to happen. I know you went to China, and now you're trying to go. Have you done things in Israel?
We have some individual patients that come from Israel, but we have not done anything more than that.
But I think that it's going to catch on, and everybody's going to want you. I hope that you're prepared for this, and you're a pretty busy guy with your family and this business. But I think that what you're looking for, maybe, is it possible that you would even be franchising this in some way?
Well, not franchising, but I think we would be co-branding.
Co-branding, yeah. That's what I meant.
And we have a lot of partners that would like to work with us. So that's something that we are definitely interested in doing. For example, if you go different service, different website, some big website that and you would see Second Opinion's logo there, and this will be happening more and more.
Yeah, I think that's very true. The other thing that I was thinking as we were talking with this is people who don't really understand what a second opinion really involves. Why don't we, I have a personal situation that I could share, but and I think I will. My husband had, just from nowhere, was having trouble breathing, a little bit of trouble, went to the doctor, and it was done pretty quickly, and they prescribed some things that I didn't think was exactly right, and but we did go, and we had went to a diagnostic center, and he had a film of his lung. And, of course, Dr. Hughes had already told me, you don't have to wait a week or days, you just get that right to me. So, of course, the first thing you do when you go to the receptionist at these diagnostic centers, they say, well, the doctor will get back to you. Yeah, right. I said, look, when you get that, I have a number. I want you to send this to secondopinions.com. And, of course, once you say that, they know you know more than they're going to tell you, which they did. It was just so simple. It was in 10 minutes they sent this to you. And, of course, I called you, and you got on it immediately, and you assured me that there was nothing major, that, you gave me some ideas, and we were we were canceling a trip to California because the doctor said we shouldn't go, and you just really grabbed a hold of it. So that's what I wanted people to know, and that probably has happened a lot with you.
It happens every day. It happens every day. This is what we're all about. We make a difference for people's lives, and we actually wanted, talking about this, I wanted to discuss some real quick. We have introduced a new feature on secondopinions.com where our customers and patients are able to upload images and have them stored right on our website for future sharing with their doctors, and it's extremely simple. And this service will be, this feature will be introduced to all imaging centers and hospitals across the country. So next time you go get your MRI or CAT scan or X-ray done, instead of walking away with a disc, you're going to walk away with a password to secondopinions.com where the images will be uploaded right away. Now, how great would it be? So we already have it. It's just a matter of time where everybody will know about it.
Listen, this is funny.
So the discs are the thing of the past. And DVDs, just like music.
Just like music. That is so good. No. I just had a mammography, I told you, over at Boca Regional, because they have this whole new thing, Sensory Suite. It's very, very, it's a big time great thing. So I had to go and get images from the last, where I'd been for 20 years. And, I have to pick up this big package with all these film in it, right? So then we took care of it, and then they hand me back this package with film. I'm saying to myself, what am I supposed to do with this film? And so normally then, you would have had that film, and I didn't have to know about it. And if I wanted to switch somewhere, you're called, and you make sure the other people get it, right?
Right.
Brilliant!
Right. So now, I predict in 2 years, DVDs will not going to exist for imaging studies, and we're going to promote this service, this feature, throughout all medical facilities with imaging capability. So we're taking this very serious, and because this is very important.
Well, I was also thinking about the woman who you brought here once. I don't remember her name. A blonde woman who. She was told that she was going to have, I think, a knee surgery, and that when she went to you and you introduced her to your various.
I think she had she was supposed to have back surgery. Back surgery, right?
Right. That's a good story. Why don't you talk about that?
Right. But yeah, she was supposed to have back surgery. She had an accident, and she went to a few doctors, and including a surgeon, who said you must have a surgery immediately, or you may be crippled and this and that. And so she found us and uploaded the MRI, consulted with a radiologist and with a spine surgeon, who said absolutely nothing serious, just do the exercises, do some rehab and physical therapy, and you'll be fine. surely enough, thank God she listened, and she's so happy that she didn't have to do surgery.
And she was here.
And
She was here.
There's thousands of people like that.
Yeah.
Now, if she had had a surgery, she probably would have been crippled from the surgery because a lot of complications. Surgeries do have complications, and imagine the cost, unnecessary cost of that. Could be tens of thousands of unnecessary dollars that we saved in that one example.
So we're not mentioning doctors. We're not even mentioning a woman's name. I have a question for you. Is this a doctor's error, or are these things that doctors are just looking for other kinds of things? I mean, I guess it's a hard question. That's not fair.
It's a hard question because each case is different. There are so many different ways, so many different options, and sometimes if you call a plumber, he's going to recommend to do, same thing. If you go to a surgeon, he's going to recommend a surgery, right? So not all surgeons some surgeons are very conservative, others very aggressive. And some, obviously like anybody else, some are corrupt because they want to, abuse the system, unfortunately. So you just don't know. In her case, we don't know if it's because he really thought that
it was
she needs
lack of knowledge or something,
lack of knowledge, or he wanted to do something more sinister. And we've seen, you probably heard some stories just a few months ago. There was this oncologist who diagnosed people with cancer who didn't have cancer, and he probably scammed Medicare by like $40 million, something like that. Or he overstaged them. So those things happen, more common.
Boy, that makes your company so important, doesn't it?
The fraud and abuse is a very serious problem.
But then it's the patient who's suffering too, like that oncologist. Yeah. I mean, someone has cancer. I mean, that's really important.
That's right.
And so, what you're saying, so what is the typical person who should be contacting you? Tell us some scenarios.
Well, actually, we have patients from all walks of life, all ages, and all ethnicities, and, like I said, numerous countries. But I can give you some examples.
Please
for example, do. We had a girl in 30s who's been suffering with abdominal pain for many years, probably 10, 15 years. And she had CAT scans, all kind of imaging, ultrasounds. Nobody was able to diagnose her, or she went to a gastroenterologist. They did all kind of, endoscopy and colonoscopy. They excluded Crohn's disease and everything. So they really didn't know what is going on. Maybe they thought it's psychologic, okay? Which is sometimes a diagnosis of exclusion. A lot of doctors are like, you're making the stuff up,
Oh, my. I love when a doctor says this to me.
Right,
You're good.
It happens.
You're so good.
So then she uploaded CAT scans, and surely enough, we discovered that she has inflammation, mild inflammation, which was never mentioned by any radiologist in her jejunum and ileum. And so we diagnosed her with some form of enteritis, because on imaging we don't know, we're not a pathologist. So sometimes we can say diagnosis with precision. Sometimes we just think it's just inflammation. So we did find a problem, and this girl took this further. And we even recommended a gastroenterologist. So our GI consulted her and suggested she may have a gluten allergy, and apparently the gluten allergy is a very, very serious problem that a lot of people working with this type of allergy, they have no idea that they have it. And surely enough, so the treatment was very simple. They just put her on a gluten-free diet, and 2-3 weeks later, the girl was like a new person.
Oh my gosh!
She no longer had frequent abdominal pains, and she basically was diagnosed thanks to one of our radiologists that read the scan, and extremely simple treatment, just gluten-free, which is no breads and that type of stuff. So this was so critical. I mean, there's people out there, that working with, for example, in this case, allergies to gluten. All you have to do is exclude breads in their diet, essentially, and it could be, that's the solution.
And so, if no one found this out and she continued, could it have been something really serious as she was aging?
Well, it's also celiac disease is associated with the gluten allergy. Typically, it's not as serious like Crohn's disease, where if you don't treat it, you might end up with losing half of your bowel and perforation. Typically, just a very very uncomfortable living, just with pain, because it's a recurrent inflammation of your small bowel. And you cannot sometimes eat, and
she probably had gas. I mean, it's probably a lot of terrible things that changed her social life and changed her.
And apparently, this gluten allergy is so common nowadays.
That's why I
and a lot of people don't know about it.
Yeah, that's right.
Yeah, and even GI specialists, some GI specialists who are not, who don't know the latest research, for example, they sometimes don't even think about it.
What? Now that is a great story, because there it was so simple. There's no surgery. You didn't need other doctors. Just some smart, consultant that you use.
Right.
That was
just one example.
Revelation. All right, give me another example.
So we had a gentleman in his 50s who has a family physician he's seen for many years, and he had developed some skin lesion that was probably 6 millimeters in size, and he didn't have it, say, a couple of years ago. But the family physician, discounted the lesion. However, when this patient uploaded the image, and we showed it to one of our dermatologists.
So wait, why did he even contact you? Because he was worried about it?
He was worried about it, right. He was worried. He needed a second opinion, because nobody thought it's something serious, for whatever reason. So he uploaded it, and one of our dermatologists who reviewed this, so he basically made a consultation, scheduled consultation, and dermatologist asked him to take a picture and measure the lesion. And when the patient consulted dermatologist over the phone and asked more questions, and when it developed, this and that, dermatologist thought that the lesion looked suspicious and sent him for biopsy. So it actually came back as a low grade melanoma. So that was one of the second opinions.
So now my question, put your physician hat on. So now the guy goes back to his doctor and says, look, you didn't even see this. What does the doctor say?
Exactly. So it's...
Oops, right? Oops.
Yes, exactly.
Oh my goodness, well.
These things happen.
All right, but it's a good thing for our listeners to realize, look, just because you go to your family physician and there's something that's worrying you, be strong about it. Say there's something here, and I want you to send this to Second Opinion. Let's see, the secondopinions.com. Let's see what it is.
It's important to have this option available.
Well, you are really doing some incredible work, and of course, the minute I heard about what you were doing, and we talked, of course, I had my own personal experience. I wouldn't let anything happen. I'm telling my friends, anytime there's something now, there are people who are being told, well, I'm the guy, I know what I'm talking about. There's lots of other people I've consulted, and that's what we think. But it's not being done, I think, as professionally as you would do, because you have it there now as a business. That's what you do. It isn't casual.
It's a very serious. It's a public service and a business. So that's not just a hobby, certainly.
No, it's not a hobby. No, far from a hobby. Let me give you some information. Of course, you can always go secondopinions.com. They have an incredible website. But let me give you a phone number for if you just don't like getting on the web. Their phone number is 855 855-573-2663. That's 855-573-2663. Their prices are for $49. It's very quick service. They deal with the world's top medical experts. Please, everybody, do not take a chance. It is the best thing that you can do if you have any problems with something that you've been feeling. Now, I want to give you another instance. I didn't tell her because I knew I was going to see you. I have someone that's been having a lot of problems orally with her teeth, and she's had a lot of dentists doing different things. Would that be something that she ought to go? Because I'm about to tell her to go do that with you. Can you also handle that?
Yes, we have dentists who can issue second opinion related to the teeth, and absolutely. It depends on the nature of a problem, but they certainly can speak.
Seems like it's pretty serious.
Speak on the phone or review the records, maybe review the X-rays. Absolutely, that could be a big. Could be a big help.
I think we need to talk a little bit about dentists because it seems like this is happening more and more, and she definitely has had a lot of problems. So
I had an issue with a dental issue. I'll tell you next time.
Okay.
My own.
See, you have to.
Basically, very simple. They left a piece of instrument in my root canal.
Oh my God!
And I
oh my God! This is all right. Well, that's the whole point. Well, Michael, it's so wonderful having you here. Every time you come, I'm more and more impressed and more. Encouraged that you're doing the right thing, so thank you again.